Do you have knee arthritis? Well, you're in the right place. Today, we're giving you the top 10 ways to treat your knee arthritis without surgery. And here's the kicker. This advice is coming from a surgeon. Now you might be thinking, a surgeon telling me to avoid surgery? Exactly. Because surgery always has risks, and if we can help you feel better without it, that's always the preferred first step. Before we begin, a quick word on sponsors. We have none. Zero. This channel has never had a sponsor in over 7 years. Our only goal is to give you unbiased information. So let's get straight into it. Number 1, activity modification. This is your number 1 treatment. It's not about stopping movement, it's about moving smarter. It is critical to keep moving even if you have sore knees, but if a specific activity like running or jumping really hurts, consider modifying it or choosing a lower impact alternative like swimming or cycling. Number 2 is sponsored by, well, weight loss itself. If you are carrying extra weight, it significantly increases the stress on your knees. Think of it like this. Going up and down stairs can increase the load on your knees by up to 7 times. So if you were carrying a 30-pound backpack all day, every day, taking it off would feel amazing, right? It's the same principle. Losing weight through healthy methods is one of the most effective ways to reduce knee arthritis pain. Number 3, physiotherapy or physical therapy. This is huge. A good physiotherapist can teach you functional exercises to strengthen the muscles around your knee, which has been proven to reduce pain. In the same category, modalities like massage and acupuncture can be excellent for managing the pain itself and improving function. Number 4, braces and orthotics. Depending on where your arthritis is, inside the knee, outside or under the kneecap, different braces can help. An unloader brace can push your knee into a better alignment to take pressure off the painful side. Similarly, orthotics in your shoes can change the way force travels up your leg and into your knee, potentially offering significant relief. Number 5, food and diet. What you eat plays a big role. The goal is to avoid inflammatory foods and increase anti-inflammatory ones. The main culprits to avoid? Alcohol, sugar, refined grains, and processed foods in general. On the flip side, focus on adding whole foods like leafy greens, fatty fish, berries, and nuts. This is just good health advice that also happens to help your joints. Number 6, over-the-counter medications. And no, we are not sponsored by Big Pharma. We're talking about old, off-patent drugs. First, acetaminophen, like Tylenol. It can help, but you must be careful with your liver. Then, NSAIDs like ibuprofen or naproxen. These are anti-inflammatories that can be very effective, but they carry risks like stomach ulcers or kidney issues, so caution is needed. Number 7, supplements. This area isn't heavily regulated, but many people find relief with things like turmeric, glucosamine, chondroitin, or MSM. The response is highly variable from person to person. The primary risk is usually to your wallet, but always check with your doctor to make sure they don't interact with other conditions or medications you have. Number 8, prescription medications. These are often stronger versions of NSAIDs that are more specific to joints, designed to reduce side effects. Stronger pain medications like opioids are also available, but we generally do not recommend them for long-term management of arthritic pain due to the high risk of dependence and side effects. Number 9, topicals and injections. Topical creams, gels, or patches with anti-inflammatories, local anesthetics, or even CBD are great because they have very low systemic absorption, meaning fewer side effects. If we need to go a step further, we can use injections. Corticosteroid injections can provide great relief, and hyaluronic acid injections can help lubricate the joint and stimulate your own natural cushioning. Number 10, alternative modalities. This includes things like red light therapy, copper braces, or magnets. The evidence for these is generally pretty weak. However, they often come with a significant placebo effect, which is real. If it works for you safely, that's okay. And I would be remiss not to add one of the simplest, cheapest things of all, ice. Icing a painful knee can make a huge difference. Just be careful not to ice directly on the skin to avoid frostbite. So those are our top 10 non-surgical ways to manage knee arthritis. Remember, you are in charge of your own health. We hope this was helpful. If it was, please do us a huge favor. Hit the like button, subscribe to our channel for more content like this, and leave a comment below telling us which treatment has worked best for you. Thanks for watching.